Hey, this is wonderful to be with all of you. I was mentioning last night, FMMA is kind of starting to feel like a little reunion. We just love coming out here and being with everybody. And we know a lot of you, and it's been nice every year to get to know so many more. And yeah, what an impactful event this has been over the years for Savvos. And so I want to talk to you a little bit about what we're doing at here at Savvos. And I think to tell you about what we're doing, I kind of want to start by talking about the problem that we're trying to solve. I think this is important because I think sometimes we get so caught up in the excitement of our solutions that we can kind of lose sight a little bit in what we're actually trying to work on. And I think this is significant because when you think about healthcare in the United States, and you think about the fact that we have access to some of the best care that you could find anywhere, if that's the case, why is everybody upset at each other, right? You look at dramatic stakeholder misalignment in the healthcare transaction, and I would submit to you that when we start, if you really want to zero in, okay, what's the center of this problem? What's the heart of the problem that we're struggling with in healthcare today? I would submit to you that the vast majority of this misalignment and problems that we're dealing with is centered on this outdated, dare I say, dumpster fire of a business model of claims processing. You think about it, almost inevitably, health plans and providers transact through a network. The business transaction happens through this business model of claims adjudication, right? Think about that experience for just a minute. You show up for a ACL repair and you're standing there at the 5:45 in the morning. You hand over your ID card, and immediately that starts the journey of submitting a claim to a network. But look at where the stakeholders are at. That provider has no idea what they're going to get paid, when they're going to get paid, if they're going to get paid. You're standing there as a consumer. You have no idea what's this going to cost me. You have no idea how many months I'm going to spend trying to solve this problem after I have surgery. Think about your health plan. Your health plan has no idea if that surgery is going to be $10,000 or $80,000. Trust me, they don't know. We've been working with one of the largest regional players in our state, and one of their executives leaned across the table from me and they said, "We don't know what these procedures cost until we submit a claim and price it with the network." You guys, these are the people paying the bills, right? So we have tremendous misalignment there. So what is Savvos doing? We talk a lot about Savvos as a cash pay marketplace, and certainly we have grown to be the largest cash pay marketplace across the country, but it's so much more. Savvos creates a digital bridge between health plans and their members and providers, and we completely replace this outdated business model of claims adjudication. Savvos is a completely different payment rail and communication experience that literally changes the entire transaction. So if you think about it, so we work with thousands and thousands of providers across the country. When we work with, let's say it's a physician-owned hospital or a surgery center, we'll come to them and say, hey, look, we've got members in your area, plug into our tech. When you deliver care today, you are paid today. There's no complex billing, no HCFA forms, no building 837 file feeds, no revenue cycle management. You are paid immediately. Here's all we ask. Here's the catch. Just give us your no-hassle cash price. You guys, in certain markets, the spend for care is coming down by 60, 70, 80%. I'll give you the secret to Savvos. You want to change healthcare? Create a better experience for providers. They will roll out the red carpet for you. Now, on the marketplace side, on the supply side, providers are plugging into Savvos every day because our technology creates a completely different experience. We monetize Savvos historically on the health plan side. Savvos works with health plans all across the country, and it's pretty exciting. We'll add our technology solution into a health plan, usually positioned as a tier 1 enhanced benefit, usually limited or no out-of-pocket cost. So not only are we bringing down spend dramatically in the plan, but we're creating dramatic benefit incentives for the member. Now, we're not the only ones that are doing that, but I would talk to you today about sustainable tier one benefits. If you're gonna start adding front-end benefit enhancement, you have to have corresponding cost savings if that's gonna endure long-term, and that's what Savvos is building. So historically, we have worked at the health plan level. Our technology, our main products that we take to market have been working with health plans. But here's what's interesting. All of the other stakeholders have been coming to Savvos over the last year and saying, we want a better transaction. We want to connect more with what's happening here. So as we started looking at the market and you look at our suite of products today, what's exciting about what Savvos has built is we are now the digital bridge across stakeholders within the healthcare space. So if you're a provider, for example, if we don't have Savvos members or health plans in your area, you can now license the Savvos tech and build your own direct pay relationships in your local market. If you're a direct primary care organization, instead of simply providing wonderful advanced primary care services next to the health plan, you can align with Savvos and put yourself at the middle of the healthcare transaction and drive dramatic savings across the entire healthcare ecosystem and healthcare offering that employer is trying to manage. And we can do the same thing with TPAs, with brokers. We align with stop loss and NGUs. And so if we start looking at the ability to create direct pay relationships across the ecosystem, we're finding tremendous success as we move away from this outdated claims processing model and get into direct pay relationships. This is where the market is headed. And I would invite everybody here. What I see in the industry is I see a lot of great tools that are being implemented, but they're being implemented on old business models. And so the more we can move away from submitting claims to a network or submitting claims to anybody and just build direct pay, immediate settlement transactions, this is the future of the healthcare transaction. So we bring a suite of products to the market right now. This is probably our big announcement. We've been waiting till this conference. This is an industry first. We've spent the last 6 months building an immediate cash health payment plan for self-funded employers. Now, this is awesome. This has been a work in process for a while. And ultimately what we're talking about is if you're self-funded, you can build a plan around the Savvos Connect technology. So think about what that does to you as a provider or you as an employer. When we implement immediate cash settlement, think about this from a primary care perspective. We eliminate networks. We eliminate restrictions. We eliminate copays. We create the most simple and engaging and immediate transaction for primary care, specialty, consults, urgent care solutions. It's a completely different experience for your employees and for your members. For scheduled medical procedures, for hospitalizations, our direct pay relationships in these markets create a completely different experience as members and providers engage in the Savvos platform, communicate with one another, share information, physician orders, medical records, notes from the last visit. We know exactly what's being done before care is delivered, and by the time that price is built out, it's locked in and guaranteed to the penny. And in terms of an affordability and experience, it's unmatched in the market. So I would invite you, as you look at ways to align with Savvos, take a look at not only our suite of products, but if you're looking for ways to make a difference within the groups that you're working with, whether you're a broker, whether you're direct primary care, maybe whether you're a provider, there's a lot of great ways to implement what we call incremental adoption with Savvos in terms of layering Savvos into existing offerings. Or if you're looking to really disrupt the market, I think you'll find that the opportunity to underwrite a self-funded plan on a true cash payment engine is going to be incredibly receptive in the clients that you're working with now. So we absolutely love this FMMA relationship. We absolutely love the theme this year, direct care. I would just add direct care with direct payment is going to completely revolutionize healthcare, and we're excited to continue to build that with all of you. So thank you. Thank you very much.